Hello everybody, this is Dr. Abdullah. I'm just now waiting for viewers. Um, so I was going to be talking about uh, essentially insomnia today. I am also the average investor, but I thought that we could discuss this as well. This is insomnia. I can discuss both topics, but I thought I'd start off with what I usually do for a living. I'm a physician. So, yeah. Uh, Let's see, how do I switch back and forth? I think, oh, this way, I think. This way? There it is. So, I was going to discuss about I was going to discuss something about insomnia. So, about timetables, like this timeline for insomnia. So, in all medicine, I'm not sure if you can notice, but there is a timeline for insomnia. So, and not insomnia, but for anything. So, you can have so for any kind of problem, you start off by having the initial symptoms or something happening inside of you, initial symptoms, and then treatment, what have you. And the four treatments are essentially cured, controlling insomnia well, or controlling it poorly. And thought I'd discuss issues about what causes insomnia, and how to help improve the problems with insomnia, both things you can do at home or things that you might need a doctor to get prescriptions for. So I thought I'd discuss this for about, I don't know, 30 minutes or so. Um, I don't know, depending on how many people are showing up. I think there's one person, I don't know. But I figured why not. And let's see. Um, let's see if I can see the chat. Let's see what the chat is saying. What is the chat saying? If there isn't a chat. My first time doing the live stream, so you'll have to bear with me. Um, if you do see me, if you see anything, you can always type. Let me know if you're there. You can always ask me questions. But I don't know. I don't see anyone chatting yet. I'm not even sure if I'm live, but I think I am. Remember, this is the first time ever, so and it says one person's watching, so I don't know. If you're there, type something. But I don't know. Let's see. Let's make sure it is. Hmm. Oh well. Anyway, if no one's out there, might as well still continue. So let's talk about causes. So the causes essentially for insomnia are varied. There's lots of causes for insomnia. One of the first ones, of course, is stress. That's what's happening at home or what's happening at work. And of course, and then one should at least begin to recognize what the causes of our insomnia is before you can try to treat it. Another one is poor sleep hygiene. Um, and I'll discuss poor sleep hygiene. If you see in the slide, you'll see basically how I discuss sleep hygiene, but I'll keep going. Next one is, of course, people have anxiety or depression. Um, some people are overtly concerned about just being insomnia, having insomnia, and that causes insomnia. Just being obsessed with, oh, I'm not sleeping right, and oh my goodness, I need a proper amount of sleep, and that's not going to help you. And then, of course, some people who take medications. So there's lots and lots of causes for insomnia, and the best thing is, how do we treat this thing? So let's go back to the slide. Again, this is my first time trying. So, oh, just to let everyone know, if anyone's watching, what have you, first time, my name is Dr. Abdullah. I am a general general practitioner here in San Jose. Um, I'm I have this channel on YouTube. I am the average investor, but at the same time, I'm a physician. This is actually what I do for a living, and investing is more as my side thing. But if anyone wants that, I can also talk about that. But I thought I'd let the internet know that I'm also a physician, and if anyone wants to ask questions, I'm always free to answer them. Oh, and I'm also on this thing called Health Tap, where you can ask doctors questions for free. Any doctor, not just me. And you've like a small amount of space that you can answer questions. And then like they give you like it's like sort of like a Twitter kind of thing. You have a certain limit of characters, you ask a question, and then variety of doctors decide, well, I can answer this and give you a little bit of a detailed response, but depending on the physician. It's pretty good. It's free. You don't have to pay for anything. If you want a one-to-one kind of thing with a doctor and for the doctor to prescribe you medications or labs, that you pay for, like, I think it's 70, $50 or something like that. I'm not sure exactly what it was for the patient last time I checked. Maybe 50, 60, $70. I think something like that. Anyway, let's go back to insomnia. So let's go back to that slide. Let's see, where is that slide? Yes. So the slide, we just talked about the causes. There's stress, either home or work, poor sleep hygiene, which I'll discuss shortly, anxiety, depression, being overly concerned about insomnia can cause quite insomnia, and medication. And remember, this is just a quick and dirty kind of talk about insomnia. I actually have way more to discuss about insomnia, but I thought I'd just introduce this. I did a radio show back in San Jose for a little bit, and this was one of the topics. I did it for, like, the radio show I did for about 30 minutes a week. It was okay. Anyway, so I thought I'd branch out of YouTube. I'm not sure if one person is watching. If you are, it says it. I'm not sure if I'm the one watching. But if you are, type something or leave comments if you're watching this later. Anyway, next. So sleep is poor sleep hygiene. Let me discuss that. So many people, quite honestly, just have poor sleep hygiene. And what is poor sleep hygiene? Basically, poor sleep hygiene is what we do as we just not sleeping. What we do and what we do as in the 21st century. We're just really poor sleep hygiene. So that begins by not sleeping at a regular time. So maybe you sleep in the weekdays around 11. I'm making it up. I have no idea. 11. And then on the weekends you sleep because it's weekend. You want to unwind. Oh, I'm gonna stay up until 1. And then it goes all over. Then maybe on a Saturday, Friday, go to sleep on a 1. Saturday you go to sleep on, like, I don't know, 2 o'clock, and then Sunday night you sleep at 12, and then Monday back to the regular routine of 11 or something. And that's not good. So that you need to establish a regular time. So if you can sleep every day consistently, say at 11, even on a Saturday, Sunday, try not to break that as much. But if you can do that, that's part of sleep hygiene, just having a regular schedule so that your body and your brain get used to a specific time, that this is sleep time. Like 11 o'clock, that is sleep time. That's not TV time. That's not internet time. That is sleep time. So that brings me on to my next point. Um, stay about being in bed. So some people just stay in bed too long. More specifically, I guess this happens the weekends for most of us. So you wake up around, maybe you go to sleep late and you wake up maybe around 10 o'clock, and you decide, yeah, I'm just gonna stay in bed some longer, and I'm just gonna you sleep a little bit more. You sleep, maybe you go to sleep. Now you woke up around 9 or something on a Saturday, Sunday, or whatever, Monday, if you have the luxury on Monday to Friday. But you go to sleep, and then you just prolong your time in bed, and then maybe on a Saturday, Sunday, or whatever your free days, you're in bed, and now you use the bed to watch TV or go on the internet in the morning. That's not good for you. That's basically what you try to do for sleep hygiene is you're trying to train yourself to make in your mind that the bed is only there for sleeping. It's not there it's not your couch. Your bed is there for sleeping only, and not for anything, well, for other things too, meaning relationships and what have you. But outside of sleeping or physical relationships, your bed is not there as your couch. It's not. You're supposed to get off of your bed and go get your sit down on a chair somewhere, go to your couch in your living room. But you've got to make this mental break of, my bed is not my. It's not where I spend my time. My bed is where I go to sleep. Another thing is taking poor sleep hygiene is also people who take daytime naps. So if you take daytime naps, um, that will interfere with your circadian rhythm to some extent. Um, And if you can try to, because taking daytime naps sort of takes away from your sleep bank, as one way of thinking about it. So that's another thing is, I've already discussed this, but this is now late at night. Now you're just say it's like 11 o'clock and you have insomnia. If you don't have insomnia, this is not, it's okay per se. Not really okay, but you should try to do less of it. But reading or eating in bed or watching really the bad one, it's not even those two really. It is not, eating, you only read so much and you only can eat so much per se. And reading usually maybe fall asleep. But the real bad one is this one: watching TV in bed and going on the internet on bed, like just browsing YouTube or reading Facebook or whatever. That's not your friend. Don't do that when you're on bed. Get out of the bed, because you'll be sucked into a world. You'll stay up later and later. It'll screw up your sleep hygiene, your sleep schedule. Watching TV and going on the internet during using the while in bed is a bad idea. Just don't do that. Don't go on your iPad, iPod, or whatever, iPhone. Just get off of it. Another thing, of course, is avoiding caffeine before bedtime, or uh, not. And then here's the next thing is not taking time to relax before bed. Some people, and for some people, they're just very, very busy, and then they just crash into bed thinking, I'm gonna have to go to sleep. I have to get. And this moves my next point of forcing yourself to sleep. Some people have this thing of, I need 8 hours of sleep, or I need like 7 hours sleep, bar none. And they have this in their mind that I've got to get this amount of sleep. And they basically psych themselves out for sleeping, believe it or not. So forcing yourself to sleep is not going to help you. You should not try to force yourself to sleep. Forcing yourself to sleep will just make life difficult, quite honestly. Some makes sleep quite honestly difficult. So um, So there's like lots of problems. Like there's a lots of issues for sleep hygiene. So we're discussing for sleep hygiene, making your bed not your bed, meaning you're using your bed for more purposes than just sleeping. You're using it as your couch, your desk for work, reading emails, watching the TV. The bed is only there, quite honestly, to for sleep and relationships, and that's about it. You should not equate your bed to anything else. So, what do we do? And what I'm discussing right now are the non-pharmacologic treatments for sleep. So, um, let's move on to the next one. Let me see if this. What is it? Let's see. There we go. So how do we improve our sleep hygiene? Well, number one is improving your sleep time, having a regular sleep time. So if you can, sleep every single day at a regular time. So maybe for you it's not 11, maybe for you it is 12 o'clock, or it's 12:30. As long as you can sleep consistently at that time period, great. If you just try, because especially if you're battling insomnia and you're trying to, quite honestly, you should not be using medicine or pharmaceuticals as a crutch. You should try to improve the problem that causes sleep in the first place. And sometimes it's just improving your sleep hygiene. So, again, keeping a regular sleep schedule would be great. Um, and then the next one, I've discussed it before, not staying in bed after waking. So you want to literally, as soon as you wake up, you get out of bed. You don't stay in bed. Just get out. Um, and if you also napping, we were discussing this before, not taking long daytime naps, and even if possible, not taking a nap at all. It's not going to be helping you. So again, I'm just reiterating. So my name is Dr. Abdullah. Let me go back. I think I might have a new viewer. I don't know. It says two. I don't know if two people are watching. If people are watching, text or write something. It's in the chat, because I know this is actually it's people watching. But my name is Dr. Abdullah. Yeah, I am the average investor, but I'm not. This is my real job. I'm a physician. And that's my hobby. I love doing it. But I thought that, well, I'd use this channel since I have like 500 subscribers. Yeah, big whoop. But I thought, If people are interested in free medical advice, I can give it. And I thought that this would be great. One a great topic is just insomnia. And let me go back to let's see. There we go. So causes of sleep insomnia are stress, not having a poor sleep hygiene, anxiety, depression, being overtly concerned about insomnia, and sometimes medication. Um, and then how can we, one way of, what I'm trying to discuss is drug-free treatments, but I am going to mention pharmaceuticals. But poor sleep hygiene, not having a regular sleep schedule, staying in bed too long, taking daytime naps, using your bed other than for sleep or sexual activity. You need to just break that habit. Your bed is there for sleeping and or sexual activity. It is not there for you to read for a long time or eating or especially watching TV or on the internet. These two, watching TV and internet is not your friend. And also literally just getting out of bed or trying to, and then improving in sleep hygiene. We're discussing keeping a regular sleep schedule. So instead of having even during the weekends a haphazard way, so maybe you go to sleep at 11, maybe you go to sleep one day at 12 o'clock, another day at 2 o'clock, another day at 10 o'clock. Trying to have a consistent time period so you can train your brain to sleep at a consistent time point. So regular sleep is important, a regular time point. And then you know and then another one is not staying in bed too long. As soon as you wake up, you should just get out of bed. Don't stay in bed. Your bed, you got to train yourself, especially if you have insomnia, that your bed is there for just sleep or sexual activity. So let's see. Um, and Try to avoid taking the over-the-counter sleeping pills. That's not gonna help. If you have insomnia, come to us, come to a doctor, let us discuss this. Let us help you. Don't try to go in it and alone. Try to, engage your doctor for your annual checkups. I can't stress that enough. Um, I have so many patients. I have patients that come in, and yes, I sort of have to goad them into, well, is this happening? Is that happening? Because quite honestly, I know sometimes it's you coming in for a specific problem, but sometimes it's good to let us know. And yeah, I know we're rushed and what have you. Doctors are rushed, and you feel like, you know, I only want a doctor. I only have like 5 seconds with the doctor. But at the same time, what you could do is just calling ahead. So let's see. Um, so and Regarding your bedroom, having a bedroom that's dark, quiet, and comfortable temperature. Cool, dark room is what you want. Um, you don't want to be your sleep should not be a hassle. So I'm gonna now move on to basically treatments with pharmaceuticals, and that includes things like Valium, Xanax. I don't like those. Benzodiazepines. I'm not a fan at all of these things. There's other medications like Ambien and Lunesta. These things you might have heard, like advertised, um, or there are other doxepin, um, and and other sorts of medications out there. Um, let's see, what else? And So my biggest thing is, and then there's a new medication, orexin receptor blocker. I think it's Cymbalta. No, not Cymbalta. Lunes. No, what is it? Uh, anyway, there's a variety of medications that we can treat. But my biggest thing I wanted to stress was that insomnia is a difficult problem. So, and then there's another treatment I've not discussed actually, and this is something you can discuss with both your physician and a psychologist, and that's called CBT, cognitive behavioral therapy. So, cognitive behavioral therapy is basically techniques that you can do, that you discuss with your physician and or psychologist slash psychiatrist. And I have actually been writing about this a little bit here and there, and I can also give a talk like that. I don't know if there's anyone interested. I could talk about that as well. So, so just as a sort of a quick recap, let me go back to that slide. Where did you go? Mm, where's that slide? There you are. So, quick recap. Causes of stress, of insomnia are stress, both family and work. Is something you can try to help work on. Poor sleep hygiene, anxiety, depression, being overtly concerned about insomnia, and medication. And I just discussed in this poor sleep hygiene. Of course, if there's depression, I'm getting this. Um, you know, it if it's depression, you need to come back to your doctor for treatment. So let's see. And then poor sleep hygiene, we were discussing. Let me go back to this. Poor sleep hygiene essentially is um, not basically not making your bed for sleep, making it there for other things. You're using it as your couch. You're using it as your dinner table. You're using it as your entertainment center. Your bed is there for sleep and for sexual activity, and that's it. There are no other things outside of those two things. You need to break that association with your bed of other things. Get out of bed. Don't stay in bed too long. Um, Go about, do your day. Just move on. And I'm not a fan of daytime napping. If you're daytime napping, that means unless you've gotten a habit into it, more often than not, it's one of the causes of your insomnia. So avoiding that. And when you go to bed, having a cool, dark room. And if all these things are not working, well, you can also try taking, well, you can then come to us. Come to us, discuss with us this problem you're having. This is a valid medical problem. This can be treated. We can do other things outside of medicine. You don't need to just take medicines for insomnia. And our goal, quite honestly, in medicine is to we might not be able to cure it. So doctors are not usually able to cure everything. Or, our biggest job, quite honestly, is to help you control the problem as best you can, as we can. If we can cure it, great. That's awesome. But you have to be cognizant that's not we can't always cure everything, and it's a work in progress. So you took years to become having insomnia. Sometimes it takes years to get out of having insomnia. So it's there's no quick fix like, oh, a doctor gave me this medicine and I went to sleep. No, you have to change your lifestyle. You have to change the way you approach things. It's just like for anything else: diabetes, high blood pressure, cholesterol, weight, of course. It takes time to have that problem. It also takes time to get out of that problem sometimes. Yeah, if someone has an infection, yes, we have antibiotics to hopefully kill it off quickly. But, medicine is not like that. It's a progress. It's a slow, methodical effort that you and your physician should have to improve your health. So yeah, I don't know. Anyone wants any kind of questions, chat, or you can leave a comment or message me or what have you. Any kind of topic you want. I'm thinking of doing this maybe every Saturday around the same time, at 10:50, 10:30 California time. I'm in California. I'm in San Jose. But so 10:30 California time, East Coast. What is it like? 1:30. So you can you can not call me, but you can message me on YouTube, ask me any kind of topic. It's first time out. I don't know if anyone was watching, but it was fun. And thanks for indulging my little first time outing. Uh, Thank you very much. This is Dr. Abdullah.